All right, so this actually started back on April 1st. Now, that was a couple months ago as of right now as I filmed this video, but it's a new pilot program that they are rolling out, in selective areas around the country, but this is likely, again, based on how most pilot programs work, this is likely going to be a nationwide thing in just a matter of time. All right, so what is it? They are now offering upwards of $500 worth of CBD products for Medicare beneficiaries. However, is it everybody? No, it's actually not everybody. Let me explain further details on this so there's no confusion. There's a lot of moving parts and there's a lot of rules around this. Now, to be clear, and as it suggests here in this article, this is not something that's being paid for by Medicare. It's not being paid for by premiums or taxpayer dollars within Medicare, but rather it is something that is being paid for out of the finances and the budgets of these healthcare organizations across the country that are included on this. However, it's actually being operated under the name of, or the acronym I should say, of BEI, which stands for Beneficiary Engagement Incentive. Which is, I'm going to be fair, kind of an interesting name, right? Beneficiary Engagement Incentive. If somebody were to say that to you, you'd be like, I have no idea what that even means. I agree. I'd be in the same position. I've no idea what you're even implying with that name. But anyway, that's the name that this is being operated under, okay? And again, participating healthcare organizations in some regions around the country would be participating on this. Now, it is not a reimbursement program. It is not a voucher program, a coupon program, something like that. It is in office, basically dispensing from a physician within one of these healthcare organizations who would literally, in the doctor's office, dispense these types of items to the actual patient. Now, it needs to be within certain categories. Obviously, there needs to be third-party testing of all these different items that may be available. It'd be an orally consumed or maybe an oil type of product, something like this. So there are restrictions on what types of items. Nothing that is, smoked. I'm just going to say that, okay? But it's nothing like that, but rather an orally consumed or maybe an oil-based product is how these are. Now, what also is super interesting about this is these would only be eligible for those individuals that are enrolled in either Original Medicare or Medicare Advantage, and again, also going under these healthcare organizations referred to as ACO, Accountable Care Organizations, okay? Again, like I said earlier, a lot of moving parts here, a lot of moving parts here. But again, that's how this pilot program and generally pilot programs in general work to start, as they have a lot of rules around them until they figure out, okay, based on this small sample size, based on the small number of people that are eligible and taking advantage of these different benefits or whatever it is that they're offering in the respective pilot program, then they start to broaden it from there. But they generally make it very, very narrow to start. Okay, so anyway, again, somebody would have to be on Medicare, and they'd have to be basically going to one of these ACO, Accountable Care Organizations, that maybe would have access to this. And again, obviously, the healthcare organization would be the one paying for this essentially out of their own budgets. Now, what's interesting is they act like, yeah, Medicare is not going to pay for this. Do you really think these healthcare organizations are just going to freely pay for this out of their budget with no big deal? Obviously, there's probably some kind of reimbursements behind the scenes from Medicare to these organizations. I mean, that'd be my anticipation. There's not going to be all these healthcare organizations that just come forward and be like, yeah, we'll pay for this out of our budget. No problem. We don't mind. Obviously, there's financial incentive to them to do this somehow, some way. But that's kind of what we know as of right now. Okay. So anyway, this is available. They're rolling this out across the country. Remember, it's a pilot program. The way that pilot programs are structured is they're very narrow, very selective participation to start, but then they roll it out. And it's generally going to be, significantly more available and abundant for people all across the country, especially Medicare beneficiaries, because they realized, as they did studies on this, that wait, a lot of Medicare beneficiaries are already using CBD type products. Maybe we should just have that included in Medicare. Interesting how that works, right? So anyway, drop your comments down below. Let me know what you think about this. It's kind of interesting. We've never seen anything like this before in the history of Medicare, but a lot of this comes with the reclassification of these types of items from the administration as of recently. So I'd love to read your comments down below. Otherwise, as always, if you are on Medicare, if you need to enroll in Medicare,